right, great. Thank you. And thanks, Lori and Jessica. Great talks. And you guys did a wonderful job, and you did a great job. Now I'm at the end. I have to think of something to say.
I'm sure you'll do a good job.
I have lots to say. So I think you guys did, like, the precision communication to me is really, I think, the key concept that is coming across here. And you guys have done a great job really honing in on the detailed aspects of communication and numeracy and things that we need to keep in mind. I want to back out of that just a little bit because I think we make a lot of assumptions based on our cultural views that information and risk estimates are actually important to people. And so I think I want to just back up a little bit out of that. And for us as providers or clinicians or whatever your stakeholder perspective might be, that not everybody really values this information the same way we do. And this always is so evident to me when I'm teaching my first year genetic counseling students, which is what my real job is. And they're so excited about all that genetic information, and they think that their patient should be just as excited as they are about all this genetic information. And they want to just spill it out in this session. And I'm always like, and they're like, but I would want to know that. I'm like, well, that's great. When you counsel yourself, you can give them all of this information. And that, as you said, that time we spend in the first 5 minutes of our sessions with our clients about what do they want, and I think we have to be very comfortable with not maybe giving all of the information and understanding that a number is not important to some people and that they either think something's going to happen or it's not. Cognitively, they might be able to say, yes, you told me my risk was a 1 in 100, but it's going to happen or it's not. So it's and I know you didn't have time to go into risk perception, which is a huge another body of literature and work. And I think that we really have to be cognizant of all the different things that take into account people's perception of what their risk is and even decision making. We also know people aren't rational decision makers. We aren't either, all of us sitting around the table. And I just want to back up a little bit from a cultural perspective, is that when we're trying to get people excited, whether it be about the initiative itself or just precision medicine, the outcome ultimately is for better health, right? So while knowledge maybe doesn't increase, is that okay? It might be okay. What makes a informed decision? And what does that mean? I think is a really interesting question, as opposed to maybe a good decision might be less decisional regret, conflict, confidence, or more confidence in their decision. And again, the critical piece of how do you actually apply that to their setting. And it takes time. I also think it's fascinating that we want to develop standardized ways of doing this or scripts. My students want me to tell them, how do I explain this? And I'm like, well, there are multiple ways you can explain this. And that's what you need to understand, is that it will depend on the person across from you, how you explain it, what graph you use, what is it, are they visual learners, are they auditory learners, are they both? And it takes time. And so Laura, you put up that great, like, these are the things I'm gonna do to be a great communicator. Well, everybody thinks they do that until you audio tape yourself or videotape yourself and you hear that language. So learning how to do it also, I would say, is a deliberative process. We can't just say, this is what you need to do. People don't do it. I role plays every day. Laura, you know this. The students think they're saying simple words, and you're like, you said phenotype, you said karyotype, you said, and even words, you're assuming they know how to get pregnant. You're assuming they know. There's so many assumptions that we walk into. And I think unless you're really deliberative about this process, it really isn't going to work. And the tension between efficiency and the time it takes to do this right, I think we're always battling constantly. The PMI initiative, I think we also be careful. We want to respect autonomy and go away from paternalistic viewpoint, which I can agree with, but remember, not everybody values autonomy in the same way. Again, it's a very Western view. So if you want diversity, and you're going to give them all these choices, there are people who don't want those choices, and that has to be something that we are cognizant of as well as we move forward.